Today's video topic, B12. What's the ideal B12 level? Do people always wonder about their B12 levels being high or low? They ask if this value has surpassed toxicity. By video end, you'll know all ideal B12 values. Before starting the video, I would like to say that the unit of B12 is picogram per milliliter. I'll provide the numbers. You must know that the unit at the end is picogram per milliliter. If there is a different unit in the laboratory value, you may need to convert it accordingly. You visited a lab, had a measurement done. B12 typically yields ideal value of 200 and 900. In some laboratories, it can be considered normal between 300 and 600. No one should be below 300 in B12. If it is less than 200, it means a serious deficiency. We had a video about B12. Please understand the importance of B12 and watch that video. When you watch it, you will already know why we measure B12. The ideal value of B12 is not actually above 300. B12 is a form of vitamin B that can be stored in the liver. All B vitamins should be taken on a daily basis. However, B12 is an exception to this rule. Once stored in the liver, B12 can be utilized for several years. However, if the stores in the liver decrease, you may need to take B12 supplements once more. If you have a chronic inflammatory disease, I recommend maintaining B12 levels above 600. And the beauty of B12 is this: no toxicity even at level 1000 or above, 1500 or above. So you won't be exposed to a toxic condition by taking too much B12. The laboratory generally does not measure above 2000, but ideally we would like B12 to be between 600 and 900. The frequent use of antacids, blood sugar medications, and certain other drugs in society can lower B12 levels. B12 levels can decrease in meds. Even if they eat meat ideally, even if they eat eggs, even if fed with animal products, B12 levels can remain low. We recommend supplementing with B12 in these individuals. If B12 is below 200, the depot form of B12 can be increased quickly with injections made from the hip. But we do not recommend it to get the cyanocobalamin form from inorganic B12 orally. People generally use this as medicine. The reason why we do not recommend using these constantly, because just like how we get B12 from meat, we also get the same B12 when we swallow the pill. This needs a long journey to pass through the stomach and intestines and be absorbed from the small intestine. What I'm trying to say is, if you can't raise B12 levels with eggs, it's also hard to raise B12 levels with pills. Here, choose methylcobalamin B12, which enters circulation directly under the tongue. If there is a methylation problem in every body, you will also prevent it. Cyanocobalamin form of B12 can be taken orally to increase B12 levels. We generally do not recommend this. In summary, the ideal level of B12 should be between 600 and 900. But you don't need to worry about whether it will harm me or cause a toxic reaction when it exceeds 900. It is not like B12 vitamin. We don't want anyone's vitamin D to be over 100, but when B12 exceeds 900, no toxic develops. In fact, since B12 can be stored for months or even years, we recommend taking a break from the supplements you use. The optimal level should be above 600. However, it is imperative that no individual has a B12 level below 200. When it's below 200, you can use B12 supplements and medications administered by injection into the buttocks. There are also versions made from veins, but since it is not very common in our country, we generally prefer injections made from the hip. If it exceeds 300, we prefer methylcobalamin forms taken orally more. B12, a vitamin that is truly essential for our body, needs to be taken from outside and is not found in non-animal foods. Storing is handy for us. If you are malnourished from animal products, you'll have a B12 deficiency. With vegan nutrition, we often see B12 deficiency. They may need to use supplements. Remember to keep your B12 between 600 and 900. Goodbye.